Have you ever pondered the mysteries of life and death? What if the boundary line between the two isn't as clear-cut as we believe? The Lazarus phenomenon, named after the biblical story of Lazarus, who was resurrected by Jesus 4 days after his death, poses these exact questions. It refers to the spontaneous return of circulation after failed attempts at resuscitation. Fascinating, isn't it? Our journey into this enigmatic phenomenon begins in 1982 when K. Linko first described it. This phenomenon, initially observed as a recovery after discontinued cardiopulmonary resuscitation, or CPR, was later named the Lazarus phenomenon by J.G. Bray in 1993. Since then, up until the end of last year, a grand total of 76 cases of spontaneous recovery after death have been reported from 27 countries around the globe. These instances are not limited to any specific age group. The youngest patient was just 9 months old, while the oldest was a staggering 97 years old. The duration of resuscitation varied greatly as well, ranging from a brief 6 minutes to an astonishing 90 minutes. The majority of these Lazarus phenomenon patients suffered from numerous health conditions, and cardiac arrest occurred both within and outside of hospital settings. Interestingly, the cardiac arrest rhythms observed in most cases were non-shockable, such as asystole and PEA. The aftermath of these resurrections is as diverse as the patients themselves. Survival time post-death ranged from mere minutes to hours, days, and even months. Notably, 6 patients achieved full recovery without any neurological impairment. So what causes this phenomenon? Several factors have been proposed, including hyperventilation and alkalosis, autopeep, delayed drug action, hypothermia, intoxication, metabolic disorders like hyperkalemia, and unobserved minimal vital signs. To prevent unintended Lazarus syndrome, it is now recommended that patients be monitored for a full 10 minutes after discontinuing CPR. This recommendation underscores the importance of spreading awareness about the Lazarus phenomenon within the medical community to improve the reporting and handling of such cases. In conclusion, the Lazarus phenomenon, or autoresuscitation, remains a fascinating and largely unexplored area of medical science. From its first documented instance in 1982 to the 76 cases reported by the end of 2022, it continues to intrigue and mystify. The factors leading to autoresuscitation are numerous and varied, and the outcomes range from brief survival to full recovery without neurological damage. As we continue to delve into this phenomenon, one thing remains clear: the line between life and death may be more blurred than we ever imagined.